What's the difference between a psychologist and a psychiatrist? Hi, welcome to Dr. Lord's Mental Health Matters. Now, I've been asked quite frequently this question of what's the difference between a psychologist and a psychiatrist, but I think there's probably a lot more people out there who have thought about the question but never really asked. So here we are today, going to have a go at answering that. Now, I've had to think about it and I've found 7 key differences that I think explain the difference and also where the similarities lie. There's probably several more key differences and I'm sure people will let me know in the comments below. Now, the first difference is the most fundamental, and from this flows all the other key differences that I've identified. So a psychiatrist is a medical doctor who's done a medical undergraduate degree, qualified as a doctor, and then specialises in mental health after that. So they'll always have a title of doctor and they'll be able to do all the usual medical doctoring things, but they've specialised particularly in mental health. By contrast, a psychologist has done an undergraduate degree in psychology, which is the study of the human mind and behaviour. They then gone on to do extensive postgraduate training in clinical psychology, counselling psychology, forensic psychology, and they may well have done a PhD as well, and that will entitle them to call themselves doctors too. So it all does get a little bit confusing, but if you remember that fundamental difference between the undergraduate degree that psychiatrists and psychologists have undertaken, everything else starts to make sense. So the second key difference is that the psychiatrists, being doctors, prescribe medication. The psychologists, not being doctors, can't prescribe medication. But don't start thinking it's 1-0 to the psychiatrists here. Yes, it's their big therapeutic weapon against mental ill health, but the psychiatrists are not so good at the next big difference, where the psychologists are going to come storming back. So the third one is therapy, psychotherapy. The psychologists are the experts on this. They have all the experience, the training, the breadth of knowledge, and they deliver psychotherapy, and psychotherapeutic techniques are used by them to help patients recover and get better. Now, psychiatrists, they do a little bit of therapy. They have a bit of an introduction to it, and if they choose to, they can expand and go into it in more detail. But on the whole, we have a relatively superficial knowledge of therapy and not that great experience at using it. So this is really a really key difference, where the psychologists are the bosses. So when you go and see a psychiatrist, what you'll experience is a kind of guided clinical conversation between the two of you. On the first appointment, it'll be about an hour long, and you'll be asked the history of your current difficulties, the history of your life. The doctor will do a mental state examination and generally share with you a formulation and what he or she thinks the diagnosis is. Now, it'll be very similar in a lot of respects if you go and see a psychologist. But the difference tends to be that psychologists will often use more formal tools such as rating scales, clinical assessment, questionnaires, and so forth. And the reason they do that is because it gives a more consistent set of responses across patients and between clinicians, whereas the medical model is much more haphazard in that sense. So you may be asked to fill in a lot more paperwork if you go and see a psychologist, but doctors, psychiatrists have started to adopt that approach as well, and many are doing a more hybrid approach. So you get the informality of a guided clinical conversation, but also some of the more empirical and consistency benefits of using clinical tools and rating scales. Now, following on from the last big difference, number 5 is the difference in how psychologists and psychiatrists arrive at a diagnosis and formulation, and how it's categorized. Psychiatrists will come to categorical diagnoses and code them in books like this. Great thick tomes with checklists in, essentially checklists of symptoms. And if you've got enough of the symptoms in a certain category at enough level of severity, you've got the diagnosis. So it's like a menu list, if you will, but not much scope for grading severity other than in fairly crude terms. So that's psychiatrists. Psychologists adopt what's perhaps a rather more sophisticated approach, using those assessment tools, clinical interview questionnaires, and rating scales we mentioned in the last big difference, number 4. Those tools allow you to measure the intensity or severity of a particular trait or symptom or part of a condition and plot it along a dimension. And that is a far more subtle way of measuring things and far more scientific and empirical in many ways. It does have disadvantages though. So the chief disadvantages are, one, it's quite time consuming administering lots of complicated dimensional rating scales. But more importantly than that, I think, is that there is a risk that if you rely completely on that sort of technique, you can lose the narrative about the patient. The patient's story gets lost, and the patient may even feel as if they're not being listened to. They're just doing lots of questionnaires. So I think that is a hazard, but it's a hazard that all good psychologists are able to avoid, and the ones that I work with do, because they do what is essentially a hybrid approach. You get all the advantages of a guided conversation, the rapport building, the patient feeling heard, getting their story told and recorded, plus you get the empirical consistency and the accuracy and the sensitivity and specificity of the clinical tools, clinical assessments and rating scales approach. I nearly forgot number 7. Now this is how you tell at a glance the difference between a psychiatrist and a psychologist. You can spot it at 50 paces in a couple of seconds. And it's this: psychologists are just, on average, far better looking than psychiatrists. God knows why, but they are. So there you have it, my 7 key differences between psychologists and psychiatrists. Let me know in the comments below if you think there's any I've missed out or have got any questions you want to ask. One of the things I do want to get across is that psychiatrists and psychologists have complementary skill sets, and we work together to help our patients. Well, I hope you've enjoyed our little rundown. If you have, please like and subscribe, and I'll see you soon.